Okay, let's go live now to Parkdale, where Mayor Olivia Chow is speaking at the opening of Canada's first social medicine supportive housing initiative.
Thinking a person like that, to be finally being able to move into a home. And I just toured that beautiful, accessible home. It's not a big apartment, but it's a home. You can cook there. You can learn to pull your life back together. You wouldn't get wet. You won't freeze. You know, you don't have to walk to a shelter or walk to find food or walk to the hospital or walk to find medication. It really is about a secure roof over the head, but it's also a chance to turn your life around. And we know the Housing First strategies talks about that. We talk about that, but to actually see it is incredible. And I look at some statistics. If a woman lives out in the street, their average lifespan is about 40-something, according to the medical officer of health in the city of Toronto. Me, you know, I'm housed, or any number of seniors that are housed, 80s. We live to the 80s. So it's half of a person's lifespan. Young person, they would die 17 years younger because they it's hard to survive on the street, right? And these kind of statistics underscore the need to build more of these homes. But if you think about it financially, the cost of the emergency ward, the cost of the ambulance worker, the EMS, which is by the city, we can unload our patients at the hospital because the emergency wards are full, which means they're stuck there, which means when you call 911, it will take them longer to get to you. And for the fire department that are stuck to wait for the EMS to come and take care of the patient, they too are stuck. So the chain impact of having the 51 people at a home, which is amazing for them, but it's also for an entire medical system and the City of Toronto first responder system is incredible. And the shelters, and I can go on and do the financial piece, but I won't because that's not what it's about. This is about a home. Dunn House is a home. As Dr. Smith outlined, it was developed collaboratively, City of Toronto, UNH, United Way of Greater Toronto, and then coming in, Fred Victor, and everyone pitching in. And this 4-story modular housing, where 51 people would be able to have supportive homes, wraparound service, kitchen, medical service, wow. And also, you know what it is that's really important? Community. Sometimes you ask them, why won't you move out from an encampment? Because there's no sense of community if they just live by themselves. There's no one around. Here is a community. It is wrapped around service. And right now, the City of Toronto is providing shelter and support to more than 12,000 people experiencing homelessness. And we also know that there are, you don't want to know the numbers, it's depressing, 90,000 people on waiting lists for affordable housing, rent geared to income housing. And it's very hard for people to find affordable housing. And then if they get evicted, you get into a downward spiral and you end up being on the street. That's why piloting and actually this kind of housing, especially supportive housing, is so precious. And it is historic.
As Mayor Olivia Chow talking outside Canada's first social medicine supportive housing initiative. Seems like a bit of a complex to help people get their life back on track.